The Newcastle Provincial Hospital is set to enhance the government's concerted efforts to bring about public services closer to where people live in an integrated and coordinated way. The Deputy Home Affairs Minister Njabulo Nzuza officially opened the Home Affairs Civil Registration Facility, which is located on site, and he joins us now. Deputy Minister, a very good evening to you. Thank you so much for joining us. Welcome to The Full View.
Thank you very much, and good evening to the viewers at home.
I suppose this move will encourage parents to register their children early and, to get their birth certificates before leaving their health facility. And the Department of Home Affairs is now working, I do understand, on expanding its office footprint in health facilities, working in partnership with the Department of Health. What informed this decision?
Well, we have been working on this project for quite some time now. The aim of the project is to promote early birth registration to ensure that all children who are born are registered within 30 days. And what better way can you promote that other than opening up Home Affairs offices in areas where children are born? If you look at Newcastle Provincial Hospital, where we were today, that hospital gives birth to 9,000 children almost every year. Now, our aim is to bring our services closer to those parents so that they can register their children in the hospital. Now, what is also good about that, it means that by the time they leave the hospital, they will be carrying a birth certificate. And that means they are no longer going to be required to go to a Home Affairs office later. So registering birth for children within 30 days is full of advantages, because remember, the first identity a child gains is through a birth certificate, which gives the child an identity number. That identity number remains with the child. When it's time for them to have an identity document, then it becomes much easier for them to get it.
So do both parents have to be at the on-site Home Affairs office at the hospital?
No, not both parents have to be there. For instance, today, out of the children that we were giving birth certificates to, we had mostly mothers. As you will know that by law now, even fathers are able to register the birth of their children. What we, however, encourage is that fathers must be present, because we have noticed that in the birth certificate, we have an allocated slot for both parents to appear on the birth certificate, in as much as they both don't need to be there. But we encourage fathers to also pitch up in the registration of their children, so that in the long run, we have records of both parents in the identity of the child, so that when the child qualifies for an identity, you no longer have to say who are the parents. You already have captured that information. So it is quite beneficial for both parents to be there, but they don't need to be there in order for a child to get their birth certificate.
Deputy Minister, I've heard so many parents in the past lamenting the ineptitude of several of Department of Home Affairs staff in terms of registration their children, and in some instances at the various Department of Home Affairs offices that had to turn back. So will the same systems be applied at the on-site offices of the Home Affairs Department? I mean, is it going to be much more efficient than the other Home Affairs offices?
Yes, it is much more efficient, because those offices are tailored to do two things. They can issue a birth certificate and they can issue a death certificate, which is part of the discussions that we have been having with the Department of Health. And that area only focuses on those two aspects only, which means you have fewer queues in the hospital-based office. You have a person who is dedicated to dealing with birth certificates, so that particular person has vast of experience in dealing with the issuance of birth certificates. If there will be errors, they will be very minimal, because their area of focus is those birth certificates. Now, what we have done is that we anticipate that by 2024, we should have reached out to more than 1,440 hospitals. We have categorized hospitals in terms of those that give higher birth. Right now, we are sitting at about 591, somewhere the 391, sorry. That's where we are sitting currently in terms of those that have live capture and they can issue birth certificates on the spot. So we really encourage parents to use that particular opportunity.
What about the ongoing issues of service delivery when it comes to Home Affairs services? And I do understand that in Durban there are only, there's only 2 Department of Home Affairs offices to serve a population of about 8 million.
Yes, we acknowledge that there have been gaps, particularly when it comes to issues of queues in our offices, which have been long. And part of the three contributors that I would like to deal with, the first one has been the issue of lack of staff. We had what we call a cap that was given to us by Treasury in terms of cost of employees. Now we have been given additional funding, which we have sourced to the tune of about more than 280 million, which will give us an additional 900 people. Some of those additional people will be posted in the civic registration offices, about 450 of them, about 12 district managers. We are looking at filling up all branch manager positions, and also about 300 of them will be posted in terms of being frontline. So that is part of the intervention in terms of boosting our human capital in the presence of the offices that we currently have. We are also investing quite a lot in technology. We are having engagements right now with banks because our greatest problem is network architecture, to look at how they have structured their network. I understand that some of them have already been in touch with the department in terms of offering their expertise so that they can also benefit from our efficiency as a department. So we are working on resolving those issues. The other one is generally the expansion of our footprint. How we had architectured our design was that, for instance, in Durban, you will have one of the largest offices being Umngeni. It's expected to service areas like Umlazi, Kwamashu, and so on. But what we ought to be doing now is going to those areas and having offices being opened in Umlazi. So those are all the initiatives that we are looking at. But in a nutshell, what we are looking at investing on for the future is a situation where technology plays a bigger role, where a person just goes fewer times to Home Affairs offices, and most of the time they rely on technology. For instance, if a person is making a reapplication for an identity, we are looking at having ways. The other way we're doing with the issue of queues is that we are currently piloting our booking system, which means a person now is able to go online and book an appointment, and they're given a date, time, and slot, and when they come to the offices, they can easily be accessible. So those are all the innovative ways that we are bringing to make sure that we cap the issue of queues and we improve on our efficiency.
You just articulated some of the innovative ways that the department will be embarking on to ensure a smooth, and efficient Department of Home Affairs. But then it suffices to say that demotivated employees are still at the Department of Home Affairs. So many of employees that I've spoken to talk about being demotivated. And, I suppose another big issue that has a huge impact on service delivery, especially in the delivery of services in the Department of Home Affairs, is the ostensible high number of allegedly corrupt, employees. I mean, I'm reading into reports that at least 2 Home Affairs officials have been arrested who have been aiding the so-called passport gang who've been selling passports to foreign nationals.
Well, the issue of corruption within our staff has been a serious issue, and we opened up a unit in a couple of years ago, which has to do with anti-corruption and also looking at security services. It has been working very well. We arrested people in Bait Bridge who were involved in wrongdoing. Just today, the minister also affected further arrests on people who were issuing fraudulent passports, obviously assisted by some of our staff members. What we can assure you is that we are going to get to all of those people who are doing wrongdoing and make sure that they go behind bars. Then these are not the only arrests that have been happening. Even in Durban previously, we had people who got arrested, some of them in Limpopo, including inspectorate officials. So we are really clamping down on wrongdoing within the department. And we really urge our citizens, because some of these criminal conducts and criminal elements are happening in partnership with our citizens. If you look at today's arrest, you had South Africans who were willing to give away their palm prints, who were willing to give away their fingerprints in order for foreign nationals to get identity into the country through passports. And we really urge our people to stop doing that, because it is criminal and they will land into big trouble, because we are clamping down on corruption and we are not going to stop up until we professionalize. And we anticipate that out of the new staff that we are going to recruit, they will also be able to bring a breath of fresh air and bring a lot of motivation, particularly at a leadership at branch level, because some of those positions are allocated created for branch managers, where there has been a gap, there's been a substantial
All
gap.
right.
So that's how we are dealing with those issues of staff.
Deputy Minister, great chatting to you. Thank you so much for joining us.
Thank you very much for having us, and good evening to all the viewers.
All right, thank you. That was the Deputy Home Affairs Minister Njabulo Nzuza speaking to us about the Home Affairs Civil Registration Facility, which is located on site at the Newcastle Provincial Hospital, set to enhance, the government's concerted efforts to bring about services closer to where people live.